She's really a pioneer in functional nutrition, and she also teaches at the Maryland University of Integrative Health. So she's also trained directly all of our nutritionists. So um, thank you, Liz, so much for coming on today. Really great to have you here.
It's so nice to be here. It feels kind of like coming back to family. So
Yes, exactly. Circling back around. And so we are going to do a little bit of community updates first, we do, and then we'll hand over to you and we'll do some Q&A. And if you have any questions, I think there'll probably be a lot of questions on this. Please feel free to write in the chat box or raise your hand via Zoom. I think Liz, Jen can show you how to do that if you have a question about it. So just want to say, first of all, that we are open. We're going to send out a MailChimp today for everyone that's a patient here. Still doing physicals, procedures, IV nutrition, and lab work. And but if you have a lab review or something like that, and you don't need to come in for in person, then if it's something more cognitive, then we can still see you via Zoom. So we are encouraging that. If you want to know the latest on the COVID tracking project in terms of how many cases and deaths there are, unfortunately, we're close to 250,000 now deaths and over 11 million cases. So it's definitely going up in the US, including in Maryland. I think all across the nation, pretty much. I think I read 94% of all counties in the US are rising right now, 94%. So keep your mask, keep social distancing, and keep your immune system up. Still go hike, still go out with your dog there, connect with your friends and family, your loved ones, get your vitamin D up, get your blood sugar down to a normal level. So we can wait for the vaccine, but we can't wait for our immune system to get healthier. So we do want to do all those things, to keep healthy so that we can have a bright future for 2021. I think it's not so clear what's happening with the vaccine still. We're probably having another 6 months of this, most likely. We have a group visit that's built to insurance that, if you haven't been already, we're going to have some new things on there, but it's called Optimizing Your Immune Health. We're talking about T regulatory cells, B cells, how it's more than just a vaccine, but we are going to talk about nutrition there, lifestyle, a lot of ways you can optimize your immune health. That's on Tuesday, November 24th at 4 p.m. And I'll be in there along with some of our other staff members, other clinicians, and look forward to seeing you there. So you can be like this person here eating your salad and vegetables, and we can talk about that today. But there's many other things to do as well. And then we have our upcoming schedule. So next Thursday, we will all be off, and hopefully you'll also be enjoying Thanksgiving wherever you are. And then after that, we have Dr. Dan Gilman. Dr. Dan Gilman will be talking about managing stress and COVID. So really excited, and obviously a timely topic for that. And then Thursday, December 10th, Tony St. Clair, a health coach, will be talking about mindset and intention, especially as we start heading into getting ready for the new year 2021. So without further ado, Liz, I'm gonna stop the share. I think here we'll talk about gut and digestive health. So we're gonna start with the open Q&A on gut and digestive health, I think, and then slides as needed. So we can go with that. Well, thank you so much, Liz, again, for coming on here. Really happy to have you here.
I'm really happy to be here. It's so interesting because I just gave a talk on Monday for Maryland University of Integrative Health on the microbiome and the immune system. And that's up on, I don't know, on the MUIH side or on the...
Is it public? Is it something we can access?
Mm-hmm. We can talk about some of that too, because it's so interesting. We're thinking about immune health, and one of the things you said is so important. It's like everybody's so focused on vaccine, right? And hand washing and masks and all that's really so critically important. But we're also starting to see that there's more on, how well we take care of ourselves, and the root issues of disease is really our own resilience. And so I love what you said about, it's important to eat right and sleep right and keep exercising and, pay attention to if your brain's wigging out and you're feeling unhappy and depressed or lonely or whatever. It's really important to focus on the basics so that we have that resilience. And 70% of the immune system is in the digestive system to begin with. And
Yes.
that's, so eating really high quality food and tons of vegetables and, vegetables and colorful foods that aren't Skittles is really important to kind of building that immune health.
I think that when you look at all the books that are written out there and all the different research papers and all the opinion masters on Google, what do you consider? And I think we could start here. What would you consider a healthy diet? What would you consider a healthy nutritional plan or diet? There's all these experts out there, right? We know about food first, and how do we get our digestive system healthy so that the rest of our body can be healthy, including our immune system. What do you consider a healthy diet? And is there one size fits all?
Well, first of all, there is not one
Right.
size fits all.
setting you up for that, but yeah.
That was
Right.
good. My main goal is that people eat mostly real food. There was a paper that came out last year that kind of upset me, but I think it was a really important paper. And what they did was they looked at what Americans are eating, and they determined that the average person's eating almost 72% of their food as ultra processed food.
Wow.
And
That's crazy.
yeah, they use this classification system called the NOVA system, whereas like an apple is level 1, right? And then the sugar and the oil and the butter and the flour and that you use to turn that into a cobbler, the salt and the spices, those
So
are
an
food.
apple is a real food from nature, and
Yeah.
an apple cobbler is considered an ultra processed food. Is that right?
No, it's
No.
actually considered level 3.
Okay.
But the salt and the sugar and the vanilla and the, oats
Yeah.
that you put on that
Yeah.
cobbler, well, the
Yeah.
oats are a level 1, but kind of the things we use to make food taste good, the
Right.
oil, the sugars, the flavorings, those are 2. And then the cobbler that we would make is level 3. And then the little apple pie that my husband got at the local grocery store that
Uh-huh.
has like confectioner's glaze on it, and and
What is that? Is that sugar? Is confectionist? What does that mean?
I don't know, they actually called it shellac.
Okay.
So, or shine. I think they called it
Shine? It sounds
shine.
like moonshine or something.
Yeah, anyway, when I looked at all the ingredients and that's the ultra processed food, right?
Okay.
And
Okay.
so we're eating mostly those packaged ultra processed foods. And so my goal is always, can somebody move to like 90% real food?
Exactly. And sometimes those apples, those just pure apples from the tree, like a Honey Crisp apple or something. It's like my daughter ate that the other day. She's like, "This is amazing, right? We don't need to have apple cobbler all the time. We don't need to have the ultra processed food. I mean, the food that we take, how do we get our taste buds to like real food again?"
I think sometimes you have to kind of do some type of elimination diet, or just, we're addicted to those foods.
Mm-hmm.
They make them so that we'll want more and more of them. If you've ever sat down to like eat a bag of chips and they go, well, this is 6 servings, ha, right?
Right.
But interestingly enough, I've worked with people who sugar is kind of their main nemesis, and within a week or 2, their taste buds are starting to really shift. And so I think just kind of making a pact with yourself that for 2 or 3 weeks, you're just going to eat only real food and not highly processed and no extra sugars will be really helpful. And we have a ton of research on the Mediterranean diet for cardiovascular disease and cancers and diabetes and pretty much everything.
Mm-hmm.
And so when I think about that, that's kind of an ideal diet to kind of shoot for.
Yeah.
And that said, if you're originally from Native American stock, well, eating more of a Native American diet would probably be a better diet for you. Or if you're originally from Ireland,
Mm-hmm.
thinking about what they ate traditionally, might be good for you. Or, your family was originally from China.
Right.
So eating a more traditional Chinese diet, because what we know is that when people eat their own indigenous diets,
Yeah.
that their health improves.
And is
So,
that because of epigenetics, or what? Why is that? I agree with that. I'm curious what the science says about why that is.
we don't really have a ton of science about the epigenetics of it that I've been able to find.
Mm-hmm.
But what's so interesting about it is that I did publish a paper about 10 years ago where I looked at all kinds of indigenous diets, and where people start adding some of those foods back into their diets, their health improves.
Yes.
And where people were originally eating their indigenous diets, even as recently as 100 years ago,
Yeah.
there was no breast cancer, and there was no heart disease, and there was no diabetes. They just didn't have chronic health issues like we do.
Well, we evolved in a certain geography and in a certain diets, and I've even seen that it's also healthier to live in a what's the word, in a meridian, or what's the, like a meridian, or I think it's a meridian, like it's sort of around the same tropical zone that your ancestors grew up in. Like your genetics have more of a self-safety response if you have that type of, if you're in that environment, climate wise even. So it's like a food and climate thing now.
It's interesting because I understand that, and I think there's some truth in it. And I also know how amazingly adaptable we are. And what we know about the genomics and
Yeah.
is that it can shift really fast. And I think that it's so important that we keep that in mind because people have traveled
That's
since
true.
there
That's a
were
good
people.
point. We're all
And
nomads, right?
we we are. And so, like I lived in Hawaii for a long time, and so my body adapted to being there, but I grew up in Chicago and I lived in
Hmm.
Maryland where it's cold. And
Yeah.
your body has to be able to adapt to all of that. And even I'm not even suggesting, for example, like that you go back to like a traditional Chinese diet because your family's been in the United States for a long
Yes.
time,
Epigenetically. Right. Right.
and so
Right.
you are Chinese American, you're really American. So
Right.
it's like, well, what would that
Although maybe we shouldn't go back to a standard American diet like McDonald's or something. Like no one should go to that. Probably. So,
no
sorry if anyone here likes McDonald's, but probably not as many. How does the Yeah, so I guess we can talk about, let's get to some questions. I don't want them to start piling up here, but then I do want to talk about the microbiome as well.
okay.
Is there a connection between gut health and Epstein-Barr virus? That's one question that is asked by Mustafa here. Thanks.
Okay, Mustafa. So I will say yes, because Epstein-Barr can really affect leaky gut, and it can disrupt the microbiome. And so if, one of my former students at Maryland University of Integrative Health is Dr. Kasha Kynes.
Yes, yes.
And she did her, research project on chronic Epstein-Barr, and then she wrote the Epstein-Barr solution, and it's really her area of expertise.
I was about to say
So
that she's the person to go to for.
she's
And I think she's in Vancouver, isn't she? She always posts these things on Facebook about like amazing views of the water or something.
she's on an island outside of Seattle.
That's
Yeah,
amazing. Yeah. Oh, is she on that island? What's it called? I forget. There's like one island outside there, I think.
there's a bunch, but I'm not sure
Okay.
which one she's on.
Yeah, so she wrote a book called The Epstein-Barr Solution. The Epstein-Barr can infiltrate any cell. Basically, it's an intracellular virus. So you look at, chronic fatigue, you look at things like autoimmunity, and then, certainly with gut issues, it's not something we see a lot on the functional stool test. We actually do. I want to ask about your take on functional stool tests as well. But, there is one test that we do that looks at DNA for viruses, and we don't really see it much on the stool, but I wonder if it's because it's a stealth virus just hiding out there, and it's not necessarily going to be in the stool or in the bloodstream. It'll just be kind of inside the cells where you can't really measure it.
What's so interesting? Years ago, I heard Paul Cheney talk, and Epstein-Barr is one of the main reasons people have chronic fatigue syndrome. It's one of
Right.
the main viruses.
Right.
And it was so fascinating because he was speaking at IFM, and he's the person who actually named chronic fatigue syndrome. And he said, he goes, we keep chasing the virus, but the virus is kind of like herpes virus or whatever. They kind of go dormant,
Yeah.
but the damage continues, the inflammation. And that we go chasing the virus a lot of times, but what we really need to do is work on the person.
Yeah. Yes, I agree. And in IFM, we also learned that when you deal with stress and when you deal with the person, like you said, the Epstein-Barr genetic expression goes dormant too. Like it's not as much damage when you manage stress, get enough sleep, eat right, things like that. So that's really the foundational treatment for Epstein-Barr. We do actually do IV vitamin C here for Epstein-Barr. So Laura and Meg are doing a lot here for the IV nurses here. So yeah, that's good. Thank you. Let's see, other questions. Sue is asking, please tell us what milk is best for people with gut issues who have osteoporosis and want to drink milk and collagen shakes. I'm assuming, are you talking about, Sue, cow's milk or like any type of milk? Because there's other types of nut milks and everything. But yeah, what are your thoughts about milk and bone issues? I think that would be a first question to talk about.
Okay, so I think there are a lot of ways of getting calcium. There's
She said any milk, so cow's milk, almond milk, whatever. Yeah.
Yeah, and a lot of the milks are fortified, and they're not really milk. They're just kind of creamy substances that we call milk. Um, you know, I think it's easier to just take a good supplement rather than to focus on what kind of milk, because I think it's important for you to drink a kind of a nut milk or a grain milk or even cow's milk that you like and that agrees with your body. And that's the most important thing. And, a couple of my favorite people in the bone health community are Dr. Susan Brown at betterbones.com and also Lara Pizzorno, who's been working with AlgaCal. And Lara is really an interesting person because
She's
she's
Joe's wife. Is that Lara?
Joe's
Yeah,
wife.
yeah. I know Marna. I know Marna here, our nurse practitioner, does do a lot of referrals to her book and stuff like that.
Yeah, and anyway, so it's Lara's own bone health was terrible, and some of the things she discovered was that she was not able to really utilize vitamin D very well, and she had to go up to really enormous amounts before she could get her vitamin D levels up. When I've seen that in practice, I'll add vitamin A because they work together as a team.
Yeah.
And also what I love about Susan Brown's work is that we focus so much on calcium and vitamin D, which are really important. But we have an Israeli study where they gave people with osteoporosis just 400 milligrams of magnesium every day for 2 years, or a placebo. And the people who got the magnesium had like a 2 to 3, actually it was higher, 3 to 5% increase in bone density, whereas the people who got the placebo had a 1 to 2% loss. And in Susan Brown's work, what we know is that there's over 21 different nutrients that are important for building bone.
Wow.
And so, we focused on these very, very narrowly. And I think it's important to broaden out the conversation. Protein is critically important. And we keep hearing, don't eat too much protein, but protein's really important for building bone. The other thing that's really interesting to me about bone and gut health is that if you don't have, for example, enough gastric acid in your stomach, you're not going to be able to absorb your minerals.
Yeah.
So maybe taking some bitters with a meal, or taking some, eating some umeboshi plums with that meal. Or
those are delicious. Yeah.
I think they're not delicious, so it's so fascinating. It's so fascinating. It's like eating olives. Like some people love olives, right?
Honestly, when I say delicious, my wife always jokes, I eat stuff for health. Sometimes I don't eat it for taste. So I just, if I know that's going through the biochemical pathways in my mind, okay, I'm eating this, it's helping my microbiome or something.
Yeah, and also digestive enzymes can be really helpful for building
Hmm.
bone. And
Yeah.
and interestingly enough, and I have nothing to do with this company, but AlgaeCal has this calcium from algae, and they are starting to get really astounding responses from bone
And
building.
there's research for that. We're starting to use that more in our practice as well. Yeah.
Yeah.
Yeah. Going along with the bone, I think, let me just make sure we had, let's see, let me find that question again. So in terms of the milk, I want to go back to that. So my understanding is that milk could actually reduce osteoblastic activity, like cow's milk. So I don't know what your thoughts are on that. I think it's a little controversial. Obviously, milk has calcium that's fortified or whatnot, so it might help. But then is it suppressing the osteoblast, especially for kids that are building bone, but also for adults that are trying to prevent osteoporosis or have osteoporosis? Would cow's milk be okay? Is your opinion on that?
So I think it's so variable. We know that 2/3 of the world's population doesn't digest lactose.
Mm-hmm.
And then like 1 to 2% of kids, well, more of kids, but adults have actually allergies to milk protein. So
Mm-hmm. Mm-hmm.
again, I think it really depends. And I haven't looked at the research on milk and osteoblastic formation, bone formation. So I haven't looked at that research for a long time and can't comment on it. But what I will say is, like, what I notice when I drink milk is that at night my husband tells me I'm snoring and that my nose feels like it's all
Yeah.
clogged up,
Yeah.
and then I get this and I think, well, if that's what I notice is
That
happening,
makes sense. Yeah. So it's really, yeah. So if
then
osteoporosis is like other issues that we deal with in functional medicine, a chronic inflammatory issue, if someone is drinking milk, like if so you're drinking milk, cow's milk, and you notice inflammation, sinus issues, joint pain, fatigue, gut issues, that might be a sign that that inflammation is also damaging your bone. Because if you have inflammation of the bone, you're likely to have more increased osteoclasts, meaning like bone destruction. So that might be more like listening to your body, trying to figure out what's going on.
always,
Um,
because I don't, we
mhm.
villainize dairy,
Yeah,
but I think it's a really nutrient dense food if
yeah,
your body likes it.
yeah.
My
It
body
is
doesn't like it.
bioavailable protein, and there are different. They're different. I think less allergenic casein type of milks. There's goat milks out there. There's obviously nut milks and different things. So just depending. Great. This is a great question too, but from Audrey. Thank you for that question, Sue. Is there a real connection between the gut and the brain? That's one of my favorite questions. Love
Yeah.
brain health. Yeah. What is that connection between the gut and brain?
Well, there's a lot of connections between the gut and the brain, but what we know, first of all, we all know this intuitively, because how often do we hear that butterflies in our stomach thing? Or I once had a client, every time she had to speak, even at a meeting at work, she'd get diarrhea from it.
Mm-hmm. Mm-hmm.
So
Yeah.
we know that there's that connection intuitively,
Yeah.
but it's interesting, the research is so fascinating right now because there's a nerve called the vagus nerve that goes all the way from our brain and the pupils of it dilates the pupils of our eyes all the way down to regulating when we feel like we need to pee and bladder control.
Yeah.
And so this vagus nerve is what really connects the gut and the brain. And what we know is that the messages go both directions, but they mainly go from the gut to the brain.
That's so interesting. Yeah. Yeah.
Like 90%. But so, like when you're stressed, your stomach might feel really weird, right? But on the other hand, if your gut is inflamed, it's going to send messages of stress and inflammation to your brain as well. And
Mm-hmm.
so we see a lot of relationship between depression, anxiety, in this gut-brain connection. And researchers in Ireland in Cork, Ireland, John Cryan and Janan, they've been working on this whole kind of HPA axis, the hypothalamus, pituitary, adrenal, and I would throw in thyroid axis, and working on kind of the mechanisms between this gut brain and how that goes back and forth.
Mm.
And they've also been working on this concept, which other people have picked up, called psychobiotics. And these are probiotics that help modulate brain function. And we see that the gut microbiome and food sensitivities play such a role in schizophrenia and depression, anxiety. I know you've seen this in your own office,
Yeah.
but you know, like somebody will come in, they're really depressed or they're really anxious, and we might try maybe an elimination diet or a paleo immune diet, renew food plan from IFM.
Mm-hmm.
And 2 weeks later, they come back in, they go, wow, I'm sleeping better and my mood's better and I just feel
Yeah.
better
Yeah.
and
Yeah. Yeah. It
life
makes a big
looks good
difference.
now. Yeah.
The psychobiotics, are there specific types of probiotics, or are you talking about more beneficial, more of anti-inflammatory probiotics in general?
No, we have a body of research now
Mm-hmm.
on specific probiotics and specific probiotics that help modulate gut brain function. So we're
That's awesome. I have to
yeah,
email me that. Yeah, that'd be great.
and you know, one of the things that's fascinating to me too is that all of the neurotransmitters, serotonin, dopamine, GABA, we make synthesized in our microbiome. Those microbes synthesize them.
Yeah.
And so this is another kind of gut-brain connection piece because those neurotransmitters don't necessarily stay there, they go everywhere.
They're called neurotransmitters, but they're really gut hormones that then go to the brain often. Yeah. I mean, serotonin is made in the brain, for instance, but less than 1% is made in the brain. 90% or more is made in the gut. So that's an interesting fact about serotonin for everyone that's heard about SSRIs and like brain health. A lot of it is gut health, right? So that's the gut brain connection. Great. And we know that gut inflammation does influence brain inflammation. I work a lot here with people with cognitive decline or mild cognitive impairment, and so we often look at the gut first to look at how their immune system is doing, is their microbiome balance. Thank you.
So important.
Kathleen, yes, Kathleen has a question. This is a specific question. I probably eat about 80% whole foods, so 80-20 plan, very little sugar and salt. Is kind of struggling with the variety of what she's eating due to some GI issues she's having. She's on a more restrictive diet, and she's on a low oxalate diet. I think usually with either oxalates from inflammation or from kidney stones, that kind of thing, or low oxalate diet. Any ideas for how to? I think what you mean, Kathleen, is how to get more variety in the diet. She's feeling restricted, I think, in terms of only can eat small portions of some foods and just feels kind of restricted. Um,
So I would recommend that you really work with one of the nutritionists at Capital Health, because they can really work with you one-on-one to figure it out. For example, if kidney stones is why you're on a low oxalate diet, then again, magnesium and making sure you get a lot of other minerals in your diet and making sure you're well hydrated are things that can really help so that maybe you can broaden your diet and not get so many kidney stones. But, if I were working with you and you came in and said, well, I've had 6 kidney stones in the last 2 years, then we would really start looking at gut health. And what I know about people who need to go on low oxalate diets because they have a lot of inflammation. And, you'll see autistic kids who like are scratching all the time. Um, Oxalates, when they're going through your bloodstream, they're like little pieces of glass shards. It's really uncomfortable. And
that's kind of a scary image. Yeah.
yeah, but anyway, and so you get kind of this histamine response where you're scratching and all this stuff. But what I learned from Dr. Bill Shaw is that a lot of times it's dysbiosis,
Mm.
and a lot of times that's fungal overgrowth that's
Hmm.
causing this reaction. So again, like working with a good nutritionist, a good integrative or functional doctor can really try to support you so that over time, it doesn't happen overnight, but that over time this becomes less and less of an issue. So unless it's a true genetic issue that you were born with and it's never going to go away, I think there's so much you can do underlying it to kind of broaden. And I can't kind of just say, oh, well, eat this, but I can say work with a good nutritionist, because they can really sit down and go, well, have you tried this? Let's experiment with this. Let's kind of look at this. And oxalates are a lot broken down with cooking as well, and sprouting and fermenting. So, there are ways around it, but again, you need somebody who's a really good guide.
So gut microbiome, food sensitivity analysis, looking at cooking, soaking, sprouting. Great. Thank you. And the magnesium is a good idea. The minerals, that's good. Let's see. As a 64-year-old with a, let's see, did I get that? 64-year-old with a family history of osteoporosis, could I eliminate vitamin D and substitute magnesium? It was a question I had typed out on there. Magnesium, I think, is as important as calcium for bone health. I think you need vitamin D and magnesium. I don't think I would skip on either of them. Get the labs checks, you're testing, you're not guessing, and then try to get the levels up. They're both helpful. Okay, what can you...
I take 5,000 units of vitamin D every day.
Yes.
And I'm out in the sun, but still it's important to do.
Yeah, and people have genetic issues like vitamin D receptor issues and different things. Okay, great. Patrice says, what can you say about microscopic colitis and treatments other than budesonide? Are there foods? I think it's an interesting topic because IBD, you really think inflammatory bowel disease, you kind of think about Crohn's and ulcerative colitis as the big two in the IBD world, but there's this like in-between thing with collagenous colitis or microscopic colitis. What are your thoughts about that?
Well, I write about it a little bit in Digestive Wellness because I break down the different types. But what's so fascinating to me is that we are getting not a huge body of work, but a solid body of work on use of the specific carbohydrate diet, which was popularized by Elaine Gottschall. And the specific carbohydrate diet we're seeing for people with Crohn's disease, pediatric Crohn's, ulcerative colitis, that it's actually calming down and works as well as the drugs. So it's certainly easier to use the inhaled steroid once a day or twice a day. It's way easier to do that than to change your diet. But I would start thinking about that. And what I like about kind of interstitial colitis is that it's more kind of a baby colitis, so it's sometimes easier to work with. And I would look for food sensitivities specifically. I would look to see which kind of foods are affecting you. And the best way to do that is an elimination diet. We have research, like my husband has eosinophilic esophagitis, or had, I should say.
I would love to know how you treat that. Yeah, that's a hard one to treat sometimes.
Yeah, so he had eosinophilic esophagitis, and he just was scoped, and now he's 3 years with zero eosinophilic.
That's amazing. That's amazing. Yeah.
And he found that his big foods were dairy and the little bits of beer and wine that he used to drink, a couple days a week. For him, those are his foods. And when he gets rid of those, he's better. So I would look at food sensitivities. I would think about things like fish oil and maybe curcumin, or having, part of your diet, like every morning I have a smoothie, and in my protein smoothie, I put a chunk of ginger and a chunk of fresh turmeric and cinnamon and berries and kale, and not for the oxalate person, but anyway,
that's nice.
Thinking about like, how can you bring down that inflammation? And food is usually our most inflammatory thing. So figuring that out would be helpful.
Right, it could be pro or anti-inflammatory.
And then, as you were saying, stool testing. Right?
Yeah.
You want to really start looking and say, what is this? Like, I had a client once who had ulcerative colitis, and we did a stool test, and he had amoebas. So I called his GI doc. I said, can you treat him for amoebas? And he's like, well, he's always going to have ulcerative colitis. I said, well, maybe if he doesn't have amoebas, he won't.
It's a root cause thing, right? I mean, sometimes if you don't test that, you don't know that it's there. Yeah, we definitely see that a lot. And certainly the parasites or amoeba or fungal overgrowth, bacterial overgrowth, things like this could actually cause IBD. That could actually cause, just like the food sensitivities, you have to probably look at both.
Yeah.
Yes.
IBD always has a dysbiosis of some sort.
That's a
Imbalance
good
in the
point.
microbiome.
Thank you. Okay, Donna says, I have had issues maintaining adequate mineral levels, potassium and magnesium. Any suggestions there? Maybe bone broth? That's kind of, I don't know.
That
What
would
do you think about minerals? How do you maintain minerals in the body?
Well, my question is this, are you seeing this in labs? Or you're
Yeah,
seeing it
Donna, maybe if you just write a
in
little bit more on that, and then we'll get back to that one. If the vagus nerve is key to overall health, how do we optimize its function and minimize its vulnerabilities? I like the way that was. Well, you said vagus nerve, but the Las Vegas nerve might be slightly different. But I like to make jokes. I know Mustafa. I know him pretty well. So, but you have Las Vegas, but you have the Vagus, which is VAGUS. The vagus nerve is that superhighway, right?
Yeah,
That's between the gut and the brain.
yeah. It's called the Wanderer because it just keeps
The
like,
wanderer, yes, yes.
yeah. So I love this question. So most of the digestive system runs on the parasympathetic nervous system, that right? And
Hmm.
so there's this tradition of like eating a big meal and then laying down for a siesta, right?
Hmm.
And we kind of ignore all of that in the, in our culture. So the vagus nerve really responds to things like saying grace or taking a moment of gratitude before you eat. It
Hmm.
also responds to meditation and exercise and laughter, and it's that chill out stuff. So when you listen to music and it makes you just want to dance, or makes you want to go within and just take it in, or when you play a musical instrument, all of this stuff is what feeds that vagal tone.
Singing, dancing, chanting, playing music, yes, all of that. Taking
Gargling
the
in
deep
the
breaths,
shower, singing in the shower,
singing in the shower, yes,
meditation,
yes.
you know,
Yeah.
being in nature, all of those things that we tend to be kind of deficient in
I
our.
feel like my vagus nerve gets activated when like hiking in the forest or something. It's just like, oh, you just like everything just kind of like like that. That's whenever you feel that that's how you know your vagal tone is working.
Yeah.
Playing with kids. We have one virtual hand, so let's call on Tony here. Tony, you're up on the webinar here. Thanks for calling in.
Oh, well, gosh. So I had just sent in a question. I am not real familiar with stool testing, and I'm wondering what it actually does provide, what kinds of information. And you had been talking about fungus present in the body, but I don't really know what else it can. I've only used it,
Before Dr. Lipski answers that question, I will just say that there's stool testing and there's stool testing, right? I mean, if you look at like a LabCorp test, which we love LabCorp or Quest, that's not the same stool testing we're talking about. We're not talking about a conventional stool test. Yeah. Okay.
Yeah. So I'm really intrigued by what's the world that I don't know.
A whole new world here. Do you want to take that question, Liz, or?
I can, or you can, either way. I mean,
Yeah, why don't I say a little bit and then maybe just I'm probably filling the gaps on that. I would say stool testing looks like a deeper dive. If you look at your gut from a conventional stool test, you might be looking at stool culture or stool WBCs, white blood cell counts, but you're not going to be really looking at a deep dive into parasites or fungus or bacteria or viruses. If they are, they're not going to catch it most likely. They're just not trained as well, and the tests are technically better on the functional stool side. So you're looking at all those different areas of potential infections or what's called gut dysbiosis, but you're also looking at levels of good bacteria, things like Akkermansia or Bifidobacterium or Lactobacillus, things that protect your gut, that protect the gut lining and basically reduce inflammation so that you ideally don't get IBD, or you can, reverse that potentially. So I think there's a lot to be said for that. There's also a lot of digestive enzyme assessment on stool testing, levels of inflammation and immune markers. It's a really comprehensive picture, like a deep dive under the microscope, so to speak, of your gut.
That's really cool. Thank you.
Yeah. I think first of all, they're not perfect, but recently they keep getting better and better, because traditionally what we would do is we would look under a microscope, and about 90% of what we can see is not able to be seen under a microscope, or cultured. But I love, because they look at digestion, they look to see, well, can you actually digest your food? They look at pancreatic enzyme function to see how well your pancreas is working. One of the really interesting tests is one called Calprotectin, which can be done separately through LabCorp, Quest, or any of the regular labs. But it's a measure of inflammation in the bowel, and it's a marker for anybody with ulcerative colitis or Crohn's or colon cancers or digestive cancers, that when it's really high, you go, uh-oh, now it's time to refer to gastroenterologist. We got something really going on here. And then, but also it's a test that's used to monitor those illnesses too, like how likely is a recurrence and a flare-up. And then, as you said, you can look at viruses, and you can look at bacterial overgrowth and fungal overgrowth. And one of the cool things is that most of the labs also have sensitivities. So they say, oh, you have really high levels of Klebsiella pneumonia, which is usually responsible for people getting pneumonia, but in the gut, it might show up as irritable bowel syndrome, or it might show up as asthma or something else. And so they'll give you, and they'll say, oh, well, these are the drugs that can be used for this, and here are the different herbs that can be used. And so it gives you so much information. And, again, they're not perfect, but they give such a roadmap about what might be going on.
Yeah, exactly. It's a clearer roadmap. If anyone remembers AAA, which is, I think, still out there, right? If you're traveling somewhere like New York or California or something, you want a roadmap. You want that person to be highlighting that map for you so you don't get lost. You can have a precise route to treatment, that kind of thing. Audra is saying, when treating or diagnosing IBD, what is the difference between the approaches of a gastroenterologist and a functional practitioner? They seem to run different types of stool tests looking for different things. Before you answer that, I would just say that a gastroenterologist is looking at the GI system. A functional medicine practitioner, functional nutritionist, is looking at the whole system, because the body's connected. Because your gut really is a gateway to your overall health. It's going to affect your brain health, immune health, heart health, hormone health, and much more, structural health. So we look at stool tests, and they are different than a conventional stool test, but there's a lot of other factors that we need to look at with functional medicine. But what I guess we kind of covered that in terms of the difference between the stool test. I would say that IBD tends to be, if it's not seen, I mean, this is my experience anyway, then if it's not seen on the scope, then it doesn't exist. But there are other, tests like a stool test that could suggest, even though it's not a gold standard for IBD diagnosis, there are certain things that could suggest, even blood work that can be done, IBD extended panel, looking at carbohydrate antibodies. I'm curious about that, because we have a number of patients that have Crohn's or UC that even the gastroenterologist won't say they have that, but the blood tests are positive. So I'm curious what you think about that.
Yeah, you'll see, I think about 60% of people with Crohn's disease have antibodies to a yeast called Saccharomyces cerevisiae, which is bread yeast. So I mean, at the most basic, like if you know that, then you can tell somebody, hey, you shouldn't be drinking beer or wine or eating bread or anything that's really fermented with that, because you've got antibodies to it, which means that's going to continue to inflame your immune system.
Is that the main pathophysiology of Crohn's? Is the anti-Cerevisiae or something? I didn't think it was, right?
No, there are other antibodies that are involved.
But that could be one of them. Yeah, got it. Okay.
And so, I'll just kind of take an example. So what happens if you go to a gastroenterologist and you are diagnosed with inflammatory bowel disease, which is Crohn's or a type of ulcerative colitis, what they're going to do immediately is try to stop that flare up and calm down the inflammation. And they're going to do that with steroids, or they're going to do that with biologic drugs like Humira, and they're going to try to bring down all that inflammation. And that's critically important. Or using aspirin for the colon, which is called asulfidine. You know, it's critically important to bring down that inflammation. But on a chronic level, diet and lifestyle change are going to be the keys to keep you from having those flare-ups, and also the keys to really stopping the inflammation. Because what we know is right now, kind of the drugs of the day for inflammatory bowel disease are these biologics, where you go in periodically, usually monthly or every 8 weeks, and you go in and you get these injections. They're really expensive, and they're really expensive, but they work really well because they're suppressing the immune system. Well, the downside of suppressing the immune system, as with any drug that suppresses the immune system, is that you have other effects. So the long-term risks of that are having different kinds of cancers, right? And so we want to have those in our back pocket in case somebody's having a flare-up. But we always want to go back to those root cause issues. And so, yeah, while it's really hard to change your diet, we know that diet in ulcerative colitis and in Crohn's disease is as effective as those drugs. Now, does that mean that you might never have another flare-up? Yes. Or does it mean that you might have fewer flare-ups, or that they're less severe? Yes, because everybody's different. But it's like, you know, again, a few years ago, I was with Dr. Jerry Mullen, and we were giving a talk at Hopkins. And one of the patients, we're talking, just gave like half an hour on food and diet and inflammatory bowel disease. And one of the men stood up and he goes, I have had 3 bowel surgeries, and nobody has ever talked with me about any of this.
Yeah, that's so sad. I know.
It's so sad. And so, you know, if somebody has inflammatory bowel disease, or they have eosinophilic esophagitis, or any of these conditions, it's so important to work with a functional medicine doc and a good nutritionist to say, okay, like, maybe I need to take these drugs for the rest of my life, but maybe I can get along without them.
Yeah. Let's go into reflux, because I think that's another, you know, thing that people out there still struggle with. And we all remember the commercials where people are eating pizza or hot dogs and like, but you're fine if you take the Nexium, if you take the purple pill. And then the opera singer comes on in the background. What is your approach to reflux? What is reflux, and you know, what really causes reflux, and how do you treat that?
Well, you probably have more experience with this than I do even, but reflux is that at the bottom of the esophagus, where it joins the stomach, there is a sphincter, kind of like your mouth, you know, it opens and it closes. And when that sphincter gets inflamed, what happens is that it loses its discernment. And so some of that stomach acid can go back up into the esophagus, and that burns because we don't have a good mucus layer in the esophagus. And we have 2 kinds of GERD, gastroesophageal reflux disease, and one is erosive. So if people get scoped, what it looks like is it's all inflamed in there. And then the other one is non-erosive. And for people who have non-erosive GERD, a proton pump inhibitor just isn't even going to help, really. You know, so there are, you know, I found that a lot of GERD, there's so many different parts of it. 1, it could be an infection like H. pylori. 2, it could be food reactions. 3, stress plays a huge role. And in my book, I have like a whole section on it. And then, you know, when we suppress acid, we use that acid, as I mentioned before, to absorb minerals. We use that acid to protect us against any fungi, mold, fungi, bacteria, parasites that come in on our food. And we use that acid to help digest protein. So the conventional approach is just suppress the acid which again then has long-term negative effects like small intestinal bacterial overgrowth, fungal overgrowth, bone loss, and a lot of other things. So,
and our best antimicrobial is stomach acid, right? Our best, you know, we're already making it, so it's kind of an interesting thing. So we're
yeah,
suppressing our immune system, we're reducing our bone density, increasing risk of heart attack. We do that, depleting the magnesium, like you said, but then we're also opening up, more food sensitivities and recurrent and chronic infections because stomach acid is a natural antimicrobial itself.
yeah, yeah. So, so again, there are lots of different things. If you want to take kind of like a approach, there's these alginates that are pretty interesting. They make kind of, they're made from algae. You can buy them at pretty much any drugstore, and some of the health food companies make them too. And they make what's called a lipid raft, and it sits between that sphincter at the top of the stomach, and it just sits there and it makes a barrier so that doesn't happen. I think acupuncture can be hugely helpful in cases of GERD, because again, it,
Definitely seen that. Yeah.
I think again, that vagal tone is really important. And then we have other things which they may or may not work as well. We have a supplement from Allergy Research Group called Sanogastrel that can work pretty well. We have DGL licorice. Again, I think bitters sometimes help. And then sometimes with GERD, it's actually structural. You have a diaphragm that's pushed out of place, a hiatal hernia. And so seeing a good osteopath or chiropractor who can manipulate it back into place. So, again, always looking at like, why do I have GERD, which is different for different people.
And we do have Mary here is on the call as a yoga therapist that I know has a protocol for GERD and structural, manipulation of hiatal hernia as well. So absolutely. Yeah, and I wonder about GERD, and is there 30% of GERD is actually bile reflux? Have you heard of, what do you think about bile reflux?
Well, I know that Dr. Jerry Mullen, who's at Hopkins, gastroenterologist, he sees a lot of bile reflux when he's scoping people. So yeah, there is a lot of bile reflux. And so again, I think structural manipulation, acupuncture, yoga therapy, I'm not sure why that's happening. Do you have an idea why that's happening?
Not really. I mean, why would there be bowel reflux? Structural makes sense. In theory, there might be something affecting the liver, gallbladder, like parasite or something like that. That's another thought I had. Okay, so let's see. We have one question about IBS, maybe. I don't know what the exact question is, but IBS, pyloric insufficiency. Araceli is saying potentially pyloric insufficiency could be causing, that's a good point. Maybe that's causing just anatomically more fluid, going up the opposite direction for bile reflux. Thanks.
I mean, bile reflux means it has to come like, all the way through the common bile duct and up through the stomach. I mean, it's fascinating.
That's a lot.
That's a pretty
big journey.
Yeah. So, but you do see it, and one of the things we didn't talk about is sometimes GERD is from too little stomach acid.
Yes.
And in my book, again, in my course, I talk a lot about those things. But you can, actually, first thing in the morning, take about 1/4 of a teaspoon in water, just maybe 3 or 4 ounces of water, and drink that and see what happens over 5 minutes. If you have good stomach acid, a normal response is that you get some burping.
A 1/4 teaspoon of baking soda, or
Baking soda.
Baking soda. Got it.
Yeah. You can also do a self-test with betaine hydrochloric acid.
Right. I want to share this with everyone before 1. It's almost 1, so I want to share that Dr. Lipski does have a a book, which is called Digestive Wellness, which you can get at digestivewellnessbook.com. I highly recommend that. I have that myself, referred to it a lot. She has a course, which is for anyone, right? The course is for anyone. Okay. The Art of Digestive Wellness, so innovativehealing.com. She also teaches at MUIH, which is Maryland University for Integrative Health. If you're interested in becoming an integrative health practitioner or integrative nutritionist, go there, go to school at MUH, and you'll see Liz in the classroom virtually here. And this is an amazing book and amazing conversation we're having. She has on, I didn't know you're so active on social media with all these accounts. I have to get more into, I'm not really into Twitter, but I will, I need to get more into some of these other things, YouTube, Facebook, LinkedIn. So you're on a lot of channels here. So you can follow her there.
Yeah,
We'll have all this available and taped for everyone here.
yeah, I don't really tweet that much, but you know, when I see something interesting or when I'm giving a lecture, I put it up on social media.
What about apple cider vinegar? This is a question from Victoria.
Apple cider vinegar is really great on a million levels, but I'm not sure exactly what you're asking. You can't kind of test stomach acid sufficiency with it, but you can use it to build stomach acid if you're low.
We have the Heidelberg test here now to look for low stomach acid, so we're really excited about that.
Oh,
yeah,
that's totally cool.
It's cool, yes. And so please comment on how to improve diverticulosis. Another question from Mary here.
Okay, so diverticulosis is something that pretty much as we age, most of us end up having, and there are these little pockets that kind of bulge out of our large intestine. And the main thing is eating more fiber, really, you know, and also getting exercise and having good abdominal tone, you know, so core strength is, I think, also important. And diverticulosis is not really a big issue until those pockets get infected, and then that's diverticulitis, and that's really serious. And again, there's whole sections in my book on treatment, but you know, we used to think, oh, you know, fiber's bad and eating nuts and seeds and all this stuff is really bad, but the research doesn't show that. So, you know, eating a lot more fiber is very important.
Great. Thank you. Let's see. I think I might have missed some questions. So, okay. Herbal remedies, natural remedies versus real antibiotics for. I think the question is more just on if there's chronic infections and constantly on antibiotics, and then the stool test shows bacterial overgrowth. Basically, if there's recurrent infections, how do you how do you deal with that? And then do you use herbals or do you use other antibiotics?
So I don't treat disease, so because I'm a nutritionist. So, you know, the important thing is if you have, for example, small intestinal bacterial overgrowth, like I'm working with a friend right now, and she's had like irritable bowel syndrome, gas, bloating, feeling like she's pregnant for decades. And she went on a trip and she overdid with friends, and this is right before lockdown, and she ended up with what looks to me like food poisoning because she started having copious amounts of diarrhea and felt terrible. She went to her doctor gave her an antibiotic, and we started a low FODMAP diet, which is the diet of choice for irritable bowel syndrome and small intestinal bacterial overgrowth. And so she, anyway, you know, basically what you see in people who have small intestinal bacterial overgrowth is that, like her, she's had this for decades. Well, it's not going to go away with one round of antibiotics. It's not going to go away with one round of antimicrobials. Dr. Alison Seebecker has this system where she's like, well, you know, if you have gas levels on breath testing that are 200, well, a round of rifaximin might only bring that down like 50 or 60. So you might need 4 rounds of this drug. What we do know from Mark Pimentel's work is that kind of one of the things I would probably go to if somebody was willing to do it would be an elemental diet for 2 weeks, followed by a breath test on the 15th day. And if they still had overgrowth, doing one more week of an elemental diet, which is really no food.
I think we follow that protocol here. Yeah.
Yeah,
Correct me if I'm wrong, but yeah.
I think, and then also sometimes with people with small intestinal bacterial overgrowth, there could be structural issues. There's a small percentage of people who have it, which you just can't figure out what the root issues are, which means kind of maybe lifelong taking little bits of antimicrobials and probiotics and, watching your diet. So, it's tricky, but, having somebody like Dr. Wong and his team to work with, really helpful.
Yes, I think looking at a functional approach, looking at all systems and how they're connected, right? Because anything could affect the gut, just like the gut can affect other systems. But you look at the structural, you look at the brain with stress, you look at certainly hormones, that control motility, like thyroid. So all those things can be really helpful. One last question. I think it's about 1:00. So again, thank you so much, Liz. We'll try to get one more question in. Christine asked, what are your thoughts on taking Miralax? My 5-year-old daughter's GI doctor says it's safe to take every day for 5 months. I guess you're talking about your 5-year-old daughter, Christine, probably. Are there any side effects of Miralax? First of all, at least I probably will not attempt to answer this question. I'm not a pediatrician, I'm not a GI doctor, so but I don't know if your thoughts are on Miralax here.
So, Miralax has been used for decades and it's considered to be really safe. And I don't really understand it. It's polyethylene glycol. It's like antifreeze.
Antifreeze, yeah, it's kind of crazy.
And so
yeah.
I'm kind of like, I kind of don't really understand all the mechanisms of why it works.
Osmotic is like osmotic it's like an osmotic effect. It draws water out, I believe.
Yeah,
that's like that.
So again, looking for, your 5-year-old daughter has a GI doc, which says there's already something pretty serious going on.
At 5.
At 5, and so working with, I don't know if you're in Maryland, but and I don't know if you do pediatrics in your practice.
We will see 12 and up. That's our official kind of thing right now. I mean, I think there are some nutritionists that will work with people functionally for the kids.
Yeah, in Laurel, I'm just blanking out on her name, but in Laurel, Maryland, there is, oh my gosh, I'm just blanking. I'm so sorry, but there's a really wonderful integrative and functional pediatrician, and she works with kids with GI issues and autism, and she's amazing. So
great. Yeah, we can share that with people down the line. Christine, yeah, we're just talking about, I think our internet went down, but we're just talking about there are nutritionists out in Maryland that are could look at your child and 5-year-old. All these recordings are going to be available on Facebook and YouTube and things. So I guess we'll just, I have to address this one. What is the difference between SIBO and Candida? There's a bacterial overgrowth and Candida is a yeast. So that's the main difference there. But I mean, they can present similarly, yes?
Yeah, they can. The GI system doesn't have that many ways to express displeasure. And so irritable bowel syndrome is, like gas, bloating, diarrhea, constipation, different constellations of that, they look a lot the same. So, and honestly, when you're using natural treatments, if you're using antimicrobial herbs, they usually will hit both the fungi.
They're an overlap, yeah.
They overlap, and then the diets are all carbohydrate restricted. They overlap.
So in a way, a lot of times people don't have one thing going on. There's usually multiple things going on in relation to the whole body as well. So there's multiple things going on in the gut, and there's a lot of other factors that are outside the gut that are affecting the gut, or vice versa. So that's kind of how the functional approach is. Want to thank you again, Liz, for coming on today. This has been wonderful, and hope to have you on another time, and we'll talk more about your course and your book. And it's so exciting to see, and I hope you're enjoying Portland, of course. Seems like good weather there. So please go check out her website there, and Digestive Wellness is a great book as well. So thank you so much, and thank you all for attending, and we will see you next week.
Oh, I just remember the name of that pediatrician. Her name is
great. Yeah.
Pamela Compart.
Oh, okay. I've heard of her. Yeah.
She's amazing, and she works with other pediatricians as well. So
That's
she's
great.
really incredible. Yeah.
Yes, I've heard really good things about her, so I'm gonna have to check her out as well. All right. I'll see you later, Liz. Thank you so much.
Thank you. Thanks, everybody.